welcome everybody to this month's PCD Live, and we're really excited to be joined by Professor Ying Cheong and Dr. Lydia Newman, who are going to talk to us about fertility and PCD. This is a topic that we know we get loads of questions about, and we also know that there's not a huge amount of research in this area. So we're delighted to have two UK-based doctors and professors joining us to shed a little bit more light on fertility in PCD. So over to you, Professor Ying Cheong and Dr. Lydia Newman. Thank you.
Hi, yeah, thank you very much, Lisa.
Yeah, thank you. Yeah, go on, Lydia. Lydia is going to lead the way, so I'm going to mute myself.
Yeah, no, I was just going to say thank you very much for inviting us to come and talk today. I'm a doctor training in Obs-Gynae in Southampton, and then I do part-time research with the university there as well. And then Ying, do you want to introduce yourself as well?
Yeah, so I'm a professor of reproductive medicine. I am a specialist in fertility care. And the area of PCD came to my attention really when we were trying to study the endometrium, and then we discovered that the endometrium has cilia. And I was looking at this going, cilia, really? Then, of course, with the University of Southampton, there are interdisciplinary meetings and so on, and I discovered that actually cilia is a thing in a respiratory medicine specialty. In fact, is a big thing. And then we got linked up with the PCD people, because by studying rare diseases, we can actually understand very much more about biology and pathology. So that's when I got interested. But Lydia came along and I said, look, that's your responsibility now. Go and of course, together with the support from the university, respiratory team and the Obs-Gynae team, fertility team, we need to set up something because we've learned so much about the PCD population and about how fertility and reproduction is impacted by PCD. So we've then obviously Lydia will explain and present her research findings in this area. So that's how sort of we got involved, quite rightly so, and uniquely so, because not many people are doing this work because they either don't know about it or don't actually recognize the importance. Lydia, over to you.
Thank you. So we're going to talk a bit today about fertility and PCD and what we know, and then also what we don't know yet as well. I'm assuming you all come along because you're quite familiar with PCD, so I won't talk much about PCD, but what is fertility, and then we'll talk a bit about fertility and PCD, and that's where the bit of research that we've done I'll talk about then, and then hopefully we'll have lots of time to try and answer questions for you as well. So what is fertility? So we're talking about whether people can conceive a pregnancy or baby. And fertility is really complicated, and it depends on lots of different factors as well. There's lots of things that can affect fertility. So things like age, lots of other medical conditions, and this is just one thing that could affect fertility. Reduced fertility or infertility you might hear about is when a couple are having can't get pregnant or conceive despite having regular unprotected sex. And around 1 in 7 couples in the UK, this just in the general population, may have some degree of difficulty getting pregnant. So I'm just going to talk a little bit more about that. We, as Ying's mentioned already, we started working with the PCD team based in Southampton, and we did a research study where we searched online and looked at all of the evidence where they've looked at whether people have had problems with fertility in PCD, or have able to get pregnant or have struggled to get pregnant. All of these studies we've looked at and then analysed them and then tried to summarise them. And the reason that we're trying to do this was to look at, do we know how many people this is affecting? Like, what proportion of people with PCD are having problems with fertility? What is actually causing problems with fertility in people with PCD? And then also, if people are having problems with fertility and PCD and they need help with fertility treatments, do these work just as well as they do in the general population as well? So in any person with or without PCD. So we found in the end, we included 108 different publications, which sounds like a lot, but actually mainly these are just case reports. So this might be one person saying this one person with PCD had this outcome, and that doesn't really tell you a lot, particularly if a person doesn't have a problem, for instance, with fertility, then you're less likely to try and get this published. So it is limited evidence, but we've summarised sort of what we can from the evidence that is available. So the first question that we were asking was, how many people are actually affected? Are people with PCD at higher risk of fertility problems? And what we definitely found, which was in contrast to previous beliefs, is that historically at one time it was thought that men with PCD couldn't have children, and this definitely isn't universally true. We found lots of cases where both men and women with PCD were able to have pregnancies or children without having, with natural conception, without having any sort of delay in fertility or needing fertility treatments. What we did find though was that compared to sort of the general UK population, the chance of having fertility problems if you have PCD does appear to be higher, both if you're male or female, compared to the general population. And it's really difficult to say how many people are affected. And I think at the moment we don't have enough research to say what the risk of having fertility problems is if you have PCD, but that it does appear to be increased. We found that it does seem to vary by studies done in different countries, and there may be some underlying reasons for that, for example, to do with genes. And we did find that fertility problems appear to be more common in men with PCD compared to women with PCD. So moving on to the second question, which was, why does PCD affect fertility? And again, this isn't fully understood and hasn't fully been proven, but these are just what we think is happening based on the research that is available. So you'll probably all be quite familiar that there are cilia in the lungs, and in PCD we know that those cilia don't work as well and can cause problems with clearing mucus and clearing the airways, and that can cause respiratory problems. But actually there are cilia in lots of different body systems, including in the reproductive tracts. So PCD, we think, probably can affect cilia in the fallopian tubes and in sperm, because sperm have a similar structure to cilia. It appears that it may be able to affect sperm as well. So this is a summary of what we think happens in women who are having fertility problems with PCD. So we think what happens is that the structure of cilia is affected, both in cilia that are found in the fallopian tubes and then also in the endometrium as well. And what we think happens is this probably affects the way that those cilia function. And then it probably has a sort of two-hit effect where it probably impairs transport of the embryo along the fallopian tube. And then it probably also is going to impact implantation of the embryo in the endometrium as well, reducing the chances of having a successful becoming pregnant. Again, this doesn't seem to be for all women, because we know that some women will have pregnancies without any problem. And then in men, again, there seems to be two sort of mechanisms by which fertility can be affected. So we think that PCD can again affect the structure of and function of cilia in the efferent ductals, which is part of the testes. And these seem to be important for keeping sperm healthy. And the other way that men with PCD may be affected is that it can affect the structure and how sperm are able to move and successfully navigate the female reproductive tract and fertilize the egg. So overall, both of these things, if they're happening, will reduce the chance of having a successful spontaneous pregnancy. And again, this doesn't seem to affect everyone, because we know that some men with PCD will have no problems fathering a child. So then we looked at where studies had reported about the use of fertility treatments in people with PCD. So again, we looked at both men and women. Fertility treatments can include lots of different things. So it can include, for example, medications, but it can also include surgical treatments. So what we mainly looked at, and what appears to have mainly been used in the studies, was treatments such as IVF. So when the sperm and the egg are collected and form an embryo in the lab and then transferred back to the womb. But there were no controlled studies that looked at how successful fertility treatments are in people in PCD. So we just don't know what the success rates are, how these compare to people in the general population without PCD. What we did find was that there was reports in both men and women with PCD who had had problems getting pregnant and were unable to conceive naturally, but then were able to conceive after using fertility treatments. So it does appear that some people with PCD do seem to benefit from fertility treatments, and they may help some couples, but we just don't know the evidence yet in terms of actually success rates.
Yeah, so this was a slide really from some of the talks that I've given around IVF, and this is, of course, in vitro fertilization. That's when we are putting the egg and a sperm in a laboratory to see if they interact with each other and then fertilize and form an embryo. Now, the slide starts, as you can see, with the woman injecting the stimulation hormone that will stimulate eggs to grow, okay? And we know eggs are growing because we can see them on scans, and we can do them every couple of days and so on to see how the eggs are growing by just assessing the sac that they're growing in, called the follicle. The follicle is a fluid-filled sac where the eggs grow in. Now, when the eggs are grown to a full size that is mature and is ready to form a mature egg that can be fertilized, we can then retrieve them. And the procedure of retrieving them is now simplified compared to, say, 10, 15 years ago. We can now do it through ultrasound scan, no cuts through the abdominal, through the tummy or anything like that. And the scan will show where the eggs are, and we'll put a very fine hair-like needle into the abdominal cavity and retrieve it. So, Lydia, if you press the play button again on that. So then now the technology is so improved that we can even see the egg being fertilized, and then the nice embryo developing, right? So we all develop from this procedure, this process, where the egg and sperm fertilize, and then it grows into a few cells, and then a few hundred cells, and then it grows in a structure called a blastocyst, only at 5 days from insemination. So you can see that this structure here now, you can see a few hundred cells, a shell. We all hatch out from a shell, believe it or not. We hatch out from a shell, and that's where we then implant ourselves into the womb cavity. So in the IVF process, what will happen is we will place these embryos that are fertilized into the womb. Well, of course, only one, preferably. We don't want to put more than one into the womb cavity, and they will. Then we will have to wait. If the embryo does its thing, or in the womb, it will implant and form a baby. Now, of course, you'd be wondering, oh, what if we have spare embryos? Because they're all fertilized. It's not a waste, because we can freeze them, okay? And then, of course, we check for the pregnancy test. Now, in the PCD scenario, as Lydia has already alluded to, we have very minimal information about how this process will benefit PCD patients. I have certainly personal experience with our patients coming through our fertility center, but the experience is limited because of the number of patients coming through. So this is, of course, you're talking about egg problem and also sperm problem. Now, if you imagine that if it was a PCD female patient, okay, maybe the egg will not travel through the fallopian tube, which are the structures that receive the eggs and meet the sperm. Now, but in IVF, we place the embryo into the uterus, so we're actually not relying on the fallopian tube. So you could argue that maybe that is actually a way, okay, to help with the infertility problem that we have in female PCD patients. Maybe, but it's a big maybe because we don't have the studies to support it. And Lydia is, of course, trying to gather all the information that is necessary so that in future we are more informed about this area, so we can actually say, okay, yes, it will help, or no, it's not going to help. Okay, but in a male scenario, that is more tricky, because then, of course, we need to actually assess now how does the sperm fertilize the egg? Well, it has to be motile. It needs to be going into the egg and fertilize it. Now, the problem, of course, with PCD patients with the sperm, male patients, is that the sperm may be immotile. So actually, it becomes a challenge for our embryologists to identify, our andrologists identify which are the sperm that are going to be the best. And that's what we are trying also, of course, to delineate, but that process is not completely clear to us. There are processes we can do to select sperm, but often it's relying on motility. So when a sperm don't move, it's very hard to know, is it going to be okay in an IVF process or not? So these are the research questions that Lydia is going to take forward in her research in a very imminent future, and I hope she'll talk to you a little bit more about it, but of course we'll be happy to also receive some of the questions later on. Lydia, sorry, I hijacked this slide, so there you go, back to you now.
Thank you. So the only other things that we were going to share with you was, so this is taken from the paper that we wrote, but and it's more aimed at medical professionals, but it's also just about so that we could highlight some of the ways that sort of you can be supported through from your diagnosis of PCD, and where fertility might impact your journey with that as well. So when people are diagnosed with PCD, obviously it's also worth thinking about in terms of when they're diagnosed, of age and things complicates things slightly. But in terms of if you're being diagnosed with a condition that we know is a risk factor for problems with fertility, then it's important that you can have accurate information about that, so that you can be informed about your condition. And then when you're actually thinking about starting a family, it's important to let your respiratory team and your PCD team know for a few reasons. One of them is that PCD, if you're a woman being pregnant, can put extra strain on your body and affects your lungs. So with PCD affecting your lungs, it is worth speaking to your PCD team about what impact that might have on you during the pregnancy, and whether you'll need extra monitoring and that sort of thing. And then the other thing is about thinking about also in terms of genetics, the risk of passing on PCD to your children, and that may be something that's important to you to know, for you to know about or not, and also maybe a risk or not, depending on what type of gene you carry, and that's something that either your PCD team would be able to talk to you about, or they can refer you to a genetic counsellor, otherwise, who would be able to give you a more personalised sort of counselling around that as well. And then the last things are about when you're actually attempting to conceive. So if you're having fertility problems, being involved with a specialist fertility team who can do the routine fertility investigations, and then help tailor fertility treatment for you if necessary. And then also at that time, it's important that you should be have access to psychological support as well, particularly if you're undergoing things like IVF. That's something that's nationally recommended, because we know that it's a difficult time for people to, and it's a very intensive thing to go through. So just looking towards future work. So hopefully there's maybe some helpful information that's in the talk, but also probably that hopefully have highlighted that there's lots of gaps in our knowledge at the moment. And there's definitely further research that needs to be done to help guide patients into what they can expect in the future in terms of their fertility, and then also help guide doctors on how best to manage this as well for patients. So we're hopefully will be advertising fairly soon in the coming few months about a study that we'll be starting, which is a questionnaire-based research study looking at fertility and PCD. And we really need as many people as possible to take part, just because it's a rare condition. To get enough data, you really do need relatively big numbers, which is hard to do in a rare condition. So we'll also let the PCD support group as well know when we're advertising it, and hopefully if you're interested, you'll be able to take part. I should mention it is only for patients, people in the UK. And then this is just a summary of sort of, I think the main takeaway points is that lots of people, like both men and women with PCD, will have normal fertility, but we know that PCD does increase the risk of having fertility problems. And then lastly, that there are lots of things that we don't know yet, and hopefully in a few years' time we'll be in a better position in terms of what we know and what we can tell you. But yeah, so I think that's that's all that we had to say, unless you want to add anything else now, Ying. We can
no, I think you've illustrated it and spoke about it very clearly. I hope it's provided information to our audience. And of course, we are here to take questions on anything we can answer. There will be plenty we can't answer, but I think it's an interactive session now that I think I'll hand it back to our chair so she can carry on.
That was a brilliant talk, and I've had loads of questions in the chat, some to me, some in the open. I've got a load of questions written down here, so I think it'd be great if we could, we've got about half an hour left, and I think it's a really good opportunity to have a discussion. Before I get into the questions, I'm going to be told off by our new chair, Katie Dexter, who can't join us today because I forgot to mention at the beginning of this call that it's actually National Fertility Week in the UK. And as part of this, PCD Support UK are trying to raise the profile of fertility issues in PCD. And we know that it's a bit of a sensitive topic and a lot of people feel a bit uncomfortable talking about it. And actually, we've realised it's only in recent years that I think because people in our charity have been more open to sharing their problems or their worries about fertility, that actually we've been able to have more open discussions with doctors like yourselves to kind of bring this issue together. So we will make sure that Lydia, when your study is recruiting, we will email this out to people on this call, again, reminding people that it's for UK people only at this point. But thank you so much for taking an interest in PCD, because there's not that many people out there that do, particularly when it comes to fertility. So let's get going on some of these questions. So we've got a brilliant one in the chat saying, in the process of collecting the eggs, is it possible to take many of them and freeze some of them for future potential embryos? Professor Cheong.
Yeah, I'll take this, Lydia, if you don't mind. So indeed, the answer is yes. I think what Juan is alluding to is a process of embryo freezing or egg freezing. Okay, so actually, this is a thing now in the fertility world where people come forward to say, I want to freeze my eggs, embryos for this and the other reason. Okay, there's a lot of discussion around, okay, should you be freezing all your eggs when you're 20 years old or 40 years old, 30 years old? But regardless of that, in this scenario, I think if you're worried about PCD as a condition that may affect your fertility, and you are thinking time is running by, because of course time or age is the primary factor at the moment for determining success of IVF or fertility treatment. The reason for that is because embryo quality is very much dependent on egg quality, okay? And the egg quality is very much dependent on women's age. Now, men, of course, will also have deteriorating sperm quality, but they're much more fortunate because they have at least 10 years, on us. The sperm is not going to be deteriorated for at least 10, 15 years, but it will deteriorate with age, but later. So for women, freezing eggs is an option. if you're worried about your fertility and you want to preserve your fertility. But it is an area that is in constant discussion and debate, because people will be discussing the value of freezing eggs or embryos earlier versus later. But as far as PCD is concerned, of course, there's other factors outside your control from a fertility point of view. And if you feel strongly, I would advise first discuss it within a fertility clinic context. Get a specialist, talk to them about it. Hopefully with someone with a fertility experience, Lydia, myself, because we will know where you're coming from. Okay, and then the second is then decide, is freezing your eggs or embryos the right thing for you to do? Okay. Now, if you're 18, it probably isn't, because you've got quite a long more time, huh? Whereas we're talking about egg quality depreciating from like 35 years type of age. So you got to be practical about these things, pragmatic about these things. So I would say yes, consider it, understand your options, and how do you do it? By talking to a fertility specialist, okay? But it's not always appropriate to freeze everything and put everything in a freezer, because it's not a guarantee. It's not a guarantee, because freezing eggs or embryos, it will not guarantee a pregnancy. Yeah, the fact is, in PCD there are other factors in play, right? Because Lydia, of course, is also looking at the uterine womb cilia environment. Now, how does that interact with the embryo? Does it actually impact implantation? Maybe there's something else that we need to do to actually facilitate that embryo or the fertilized egg sticking to the womb. Okay, so these are all things that are important. Sorry, am I over exceeding my time?
Not at all, not at all. That was actually something that was another question that has come up, and I thought it might be good to just revisit that point, just to make it really clear about so in the past, I remember when I was young, and when I was sort of growing up as a teenager,
You're still young.
I'm still a bit young, yeah. No, all right. When I was really
what are you talking about?
When I was really young, I remember reading the research that was available, and they used to talk about cilia being in the fallopian tube. So we'll talk about women first, and then we'll talk about men after. And so they say there's a potential of having a higher risk for ectopic pregnancies. So that's where you have a pregnancy that develops in the fallopian tube, and it's unfortunately not viable. It's not going to work. But actually, it's only it's only from both you and Dr. Newman that we've heard about the endometrium. So this is the lining of the womb, isn't it?
Yeah.
And
Indeed.
It's only recently that you've spoken about cilia in that. So I don't know, Dr. Newman, would you, or Professor Cheong, would you mind just explaining again about that? And
yeah, I'm just going to add quickly about the, because you mentioned about ectopic pregnancy, which again is something that is historically thought to be at higher risk. So this is because you've got cilia in your fallopian tubes, and it's thought that they may help the movement of the egg or embryo along, so that it's in the womb then to implant in the right place. But and so it's thought that if those aren't working properly, maybe you're at higher risk of ectopic pregnancy. But there's actually not that much evidence from the research that this is the case. So I mean, we probably still don't have enough evidence to say that this isn't the case, but equally, I don't think that people should be worried that they're at a lot higher risk, because from the studies that there are, they haven't reported this. So that is one positive thing, just to say.
Yeah, and pertaining to the question around the womb, yes, it's a very interesting topic, because this is of recent, well, I say recent because our technology in investigation of the uterine, the womb lining has advanced because of technology in terms of imaging, etc., etc. Okay, so if we're talking about how that interaction may impact on fertility, that's a big question mark. We don't know, and that's a big area of Lydia's research also, is how is that impacted on in, for example, where there is a genetic mutation that is known. And the early work that we've done, and we have some published and some in publication, is that there are some associated sort of mechanism that is appears to be is different from normal. Okay, so we are pursuing this avenue because the thing is to study pathology, which is something where it's abnormal, and to be fair, infertility affects many other conditions and people, not just PCD. And the thing about PCD, what's interesting is that there is a very definitive factor that's affecting this cilia. Okay, and what we're interested in is, okay, how do we learn from this? Okay, and how do we help PCD patients? First priority. Next priority, how does that actually affect everybody else? Okay, because very often you'll find that rare conditions teaches us about biology and pathology. And that's where we will learn about how to also effectively treat so many other conditions alongside. But the priority is, of course, understand this condition in much more detail, and then we then be able to focus on other things. But that's a huge value in this, right? I don't know if that answers your question, but there's a lot about endometrium or the womb that we don't understand, but we now know, and we have seen it with very detailed imaging, that the womb has cilia. I mean, I'm surprised. Yeah, I surprised my scientists. They're like, oh, there's cilia in there. What's it doing? We don't know. Okay, we don't know. So we are looking into it amongst many other things. And Lydia will, of course, take this work forward together with her other organizational work around the collation of data, etc., etc. But I hope that answers the question you've asked.
That's really, really helpful. And thank you for that clarification. So I'm sure everybody on this call will understand, it's very early days of research in this area. I'd like to just come to a couple of other questions that I've got in the chat, which they've been sent to me directly, so you may not see them. So someone has a question for the speakers, and they want to know whether we know much, and this, again, I will warn everybody that when you've got different specialities, we're not experts in everything, but so someone's asked, do we know much about the progressiveness of PCD and how this may affect fertility? And I guess what we could say, we know about maybe women's health and how that might affect fertility, perhaps. So
that's a very good question, which I wish our respiratory team was on here now. Lydia, why didn't we forgot about them? No, we didn't forget about them, but we thought it was sort of more fertility discussion. But I can take it on a global the question on a global sort of respect, is that actually if any medical disease is severe, so this is not even pertaining to PCD, it could be anything, right? Could be diabetes, could be renal, kidney problems, any breathing problem or cardio, anything that is severe will make fertility worse. Full stop, okay? Why? Because if you think about it, evolutionarily, evolution, so people, from like apes and so on. Yeah, we've evolved to perceive our environment very, very carefully, you know. So it's a bit like all our, you know, the people, the animals and so on you see around the world, you know, the deers in New Forest, whatever. You know, when the environment is poor, people don't, people, mammals, animals don't reproduce. Why? Because they're preserving self. Okay, so if there is a starvation or if there's a drastic condition that threatens health for the person's survival, they will shut down the reproduction, because the reproduction is like when everything's all looking good, then it will trigger the ovulation, and so on. So if a medical condition, if PCD was severe, meaning, for example, the condition is not well controlled, there's a lot of respiratory infection, etc. I mean, I have to say I'm not an expert PCD. I wish you know, Jane was here or whatever, you know. But if you have severe infections, etc., then you would anticipate that fertility would be not so good. So yeah, so we need to work alongside, which is what we're doing with our respiratory specialists, which we are, to ensure that when patients come to us, they are optimized as far as they can, right? So that we can give them the maximum chance from a fertility respect. I hope that answers that question.
I think that's a really good bit of information. I think from, again, because we don't have a huge amount of evidence to rely on, but what we know in the charity at PCD Support UK, and the kind of guidance that we've given when we've asked this question before, is people say, well, you want to try and make sure your health is as good as possible, particularly if you're a woman, given that you're the person trying to get pregnant. And things like trying to avoid infections, you know. And I know I had a question when I was very young. I was worried, and I don't know where the thought came from, but I was very worried that if I was taking lots of antibiotics all the time, would that affect my fertility? And I remember speaking to a doctor, and they said, well, actually, you're having lots of bad infections is more likely to affect your fertility than taking regular antibiotics. So I think this is a big question, but what we tried to say is about kind of, you know, trying to be in the best condition possible, don't we? I've realised we've focused a lot on female fertility, so I want to just come to a couple of male fertility issues. So I have had, let me just go and find my question. With men who have PCD, they've asked, are there ways to find out about the viability of their sperm before they try to conceive? I think this is a really great question, and it might be a difficult one. Here we go, Lydia.
Yeah, Lydia, go on.
I mean, maybe I'll start on this and then you can add anything. But I guess so that there are ways that obviously you can look at the structure and function of sperm, and those are the sort of tests that would be done if you're looking at having fertility treatments like IVF. But also, I think that would probably only be provided privately. And it's also not a guarantee, even if the sperm look normal, that you're going to have a normal pregnancy. So I maybe would argue, is there any benefit to doing that? But I don't know Ying, what you think.
Could I just come in very quickly just to add a point? So in England, the commissioned PCD service should allow for this testing. Unfortunately, it's not as transparent for females because it's much harder to test for female fertility. But if you are under one of the 4 centres, so Southampton, Leeds, Leicester, or the Royal Brompton, and you're a male and you're interested in finding out about your kind of sperm health, it's worth having that conversation because you might be able to get referred. I know a lot of people who have been able to have that referral and they've been told about the kind of viability of their sperm. I get your point, Lydia, about you might, is that helpful or not to know, because that's not the only thing that affects fertility. Sorry?
sounds like that was completely wrong what I said.
No, it's just, I think, like we say, this is PCD is a rare disease and people are treated at different hospitals. There's not necessarily consistent care everywhere, but I think it's always it's what you've highlighted in this talk is that it's really important to speak to your PCD doctor, your respiratory doctor, and a lot of them, I think, are willing to refer to fertility for men to have their sperm checked. I don't think it's a guarantee, but it's always worth asking. Sorry, Professor Cheong.
I think both of you are completely right. Now, the reason for that is this, right? When we look at sperm, okay, WHO will have an organization, will have a criteria for looking at sperm, right? Now, the criteria is based primarily on three things. There are other things in the sperm report, of course. The first is how many sperm is in a mil of semen, right? And kid you not, our andrologists look at it in very detail, right? And we will want to know if this is at the threshold for ability to fertilize eggs and so on. So we're looking at a concentration, it's number of sperm per mil, right? And we're looking at 15 million per mil of sperm. That's a lot of sperm, you would think, but that's the ballpark from gathering from the general population. Now, the next criteria, okay, is motility, meaning how well the sperm is moving. Is it moving from A to B, or is it moving round and round? Going round and round is obviously not great. Moving A to B is good because it needs to travel all the way to the fallopian tube, as Lydia has already alluded to, okay? So that motility has to be exceeding 40%, okay? The third thing we're looking at is morphology. How does the sperm look? It should have a good-looking head, good-looking tail. Everything needs to fit the right description. But of course, because there are millions of sperm produced in men, most of them will be abnormal looking, and that's absolutely fine. There's no high threshold for this. 4% morphology is all we require. Now, in my experience with PCD patients, the key problem is in motility. Why? Because it's cilia, the cilia machinery. Yeah? So the motility will be low. Or
motility is the speed, is it?
Yeah. How it moves from one place to the other, right? A to B rather than around, or not moving at all, right? So if motility is a problem, it's a problem because you can imagine if the sperm is not moving, it's not going to go anywhere. So it's not going to get to the egg. How is it going to get to the egg, right? Okay. So in our experience with our fertility center, where we get PCD patients, men with motility issue, the issue there is, can we pick the right sperm? And that's the question I think the individual is asking, or whoever's put the question. Vitality, meaning, is it alive? Is it not alive? Do we know? Do we not know? And that is still a challenge, because whilst WHO set all these criteria for normality, and that's, of course, in the population setting. In an individual setting where you have no motility, how do you know if the sperm's moving or not? Well, there's a few things that andrologists will say to you, oh, we can do this test, check if the tail of the sperm curl or not. We can check if the DNA of the sperm is normal or not. Unfortunately, with all these tests that we can come up with, doesn't allow us later to reuse the sperm. Do you see what I mean? So it's not about knowing it is alive or not, but it's about knowing this is alive, I need to pick it now. And the problem is technology doesn't allow us to do that right now, but there are emerging technologies, so don't lose faith. There are emerging technologies that are now allowing, hopefully, that we can do this. But right now, this is the particular challenge that we have. is how do we know amongst this 15 million sperm that's absolutely not moving, which one should we pick? If we were to take the sperm in IVF to put it into the egg. Because of course, if the sperm's not moving, you need IVF, yeah? Because the sperm is not going to get to the egg. So what we're going to do, we'll have to use a technology that picks the sperm, put it in the egg. But how do you know which one to pick? Because they're all not moving, right? Usually they'll be moving and they'll go, oh, that one's not moving, I'm not going to pick you. That one's got 2 tails, I'm not going to pick you. I'll pick you because you look really nice. And they'll pick that. But in a PCD setting where it's not moving at all, where there's zero motility, that's our problem. Well, if there's a variation of motility, arguably there will be some ability for us to discern that, but there is no technology at the moment that actually can say, I'll pick you. It's emerging, but it's not there yet. I hope that answers your question.
That's very, very helpful. We've got 6 minutes left, and there's still lots of questions that I need to ask from the list in front of me, but I also wanted to mention a couple of other things. So as I mentioned earlier, it's Fertility Week. And this has not worked very well for me. Hang on a second. And we have put a lot of resources on our website to try to make more stories about fertility and PCD available to people. So I will ask another question in a second, but my pre-prepared copy and paste has not worked. So whilst you're answering the next question, I will find the links to put in the chat so that people can read some more stories about people's experiences with PCD and fertility. And that goes to the next point, which is, I think, a word of warning that we should give out as a charity is to people that maybe haven't started their families yet and are not planning to immediately, to not assume that just because you have PCD, you have infertility or subfertility. So I remember years and years ago speaking to quite a young woman who thought that she has PCD, she's going to have fertility problems, and she had a big surprise. And so she found out that she was pregnant. This is many, many years ago. And she just said, I just assumed it would never happen. The same for men as well. So although fertility issues in men are maybe more prevalent than in women by the looks of things, but still prevalent across both sexes, just because you're a male with PCD, don't assume that you'll have infertility or any problems necessarily. So I think it's really important that we balance the kind of emotion and kind of knowledge in this area, because as you have both very well explained, that actually some people don't have any problems and some people do. Another question, can the quality of sperm in PCD specifically change over time? So we know that in the general male population, I believe that sperm can change in quality, can improve and can get worse. Do we know what the situation is for men with PCD?
Lydia, you want me to take this? Yeah. So it will apply to pretty much all males. So we already touched on how healthy or how optimized the condition is if you have a chronic condition. So if you're optimized, the sperm quality will be better, 100%. Okay. Now, the other aspects of life comes into play. Smoking, alcohol, caffeine, name it, those things of course need to be optimized, or else of course they will have a certain impact. If you want to know more of those details, nice guidelines have all named a health lifestyle guidance to optimize fertility. So I think these are more the factors than actually pertaining to PCD condition itself.
Thank you. And so that's really interesting that actually this goes for both men and women, that being in the best health possible, not drinking too much alcohol, not smoking, regular exercise, all contributes to good fertility. I've got a couple more questions now and only 3 minutes to go. So one question is, and let's stick with the topic of sperm health, and then we're going to go to a kind of general fertility question. So if there is no motility in the sperm, does that mean that IVF is not possible to have?
No, it's possible, except we will be going in slightly blind. We have to pick the sperm as we can pick, and it's potluck basically. But we can, of course, still inject the sperm into the egg and at least allow it the opportunity to fertilize.
That's really helpful, thank you. And another question is about sort of funding for IVF, and this is for people that haven't sort of looked into this before, this is a bit of an issue that depends on where you live. So I might just answer this one quickly, which is a question that says, is there any financial support available for PCD patients in England for the IVF procedure? My understanding, and please do correct me, Dr. Newman and Professor Cheong, is that although some of the PCD services can refer you to fertility, so your specialist hospital might be able to make a referral, often what happens is you do still have to go through the GP. So any condition or person who's experiencing fertility problems can go to their GP and say this, and you have some tests and they can make a referral. And how many rounds of cycles of IVF, if that's the appropriate treatment, how many cycles you are eligible for depends on where you live.
Absolutely.
Is there any other information on that we?
I think that's exactly what you've just said. Absolutely agree.
And thank you. And I think that's really important for people to be aware of. And very quickly, how long would you say someone should start trying before they then seek help for fertility?
Would generally, Lydia, you want to answer?
Yeah, I mean, I was just going to say that, so generally for the general population, the national advice is that you have to be having regular unprotected sex for a year before you go see your GP. They do initial investigations and then you get referred to a fertility specialist. But there is the caveat that if you've got a condition where you are known to be at higher risk of fertility problems, then it should be possible to be referred before that. I don't know if you want to add anything here.
And one thing I wanted to stress from a point that we earlier discussed is that whether it's normal fertility for yourself or if you're suffering from difficulty conceiving, I think from a research perspective, to understand the condition so that we can pave the way for future PCD patients, is actually to be engaged with the research that we are going to do, because we will need normal and of course those people who are encountering problems to be able to understand the condition better. So whilst please do spread the word to say actually, PCD, whilst infertility is absolutely fine, please still do try to engage in the research that we're going to propose in the near future so that we can understand the condition better. And thank you for the support UK post at the chat about the research that's occurring. And Lydia, you can see that there are some studies which I don't know whether we knew about it or not, but they're all going to help coalesce together at the end of the day in us understanding the condition better. But here in Southampton, we are much more interested in the biology, but also mechanistically what the cilia in the uterine environment is doing that will contribute to implantation or not. So that's a specific area that we are specializing in, and we have the expertise to do the research.
Thank you both so much. It's been a really interesting discussion tonight, and I know that there might be more questions to come. So if it's okay, I've told people to email me, and we can send those questions to you and get more answers. I just want to thank you again. It's been really, really interesting, and we've learned a lot. If people are interested in finding out more, you can visit our website, and you'll see that we've got a link to our Fertility Awareness Week. And there's a study on there at the moment, but we will put Dr. Newman's study on there as soon as it's recruiting. And there's lots of stories from people with PCD about their journeys. So I'm wishing you all a very, very good evening, and thank you so much for joining us tonight. Cheers.
Pleasure for joining. Take care. Bye-bye.